Welcome to this lecture on mandibular major connectors. Let's take a look at what is a major connector. A major connector is that part of a partial denture that connects the part of the processes located on one side of the arch to the parts on the opposite side. We have maxillary major connectors and mandibular major connectors. What are the ideal requirements of a major connector? First and foremost, it must be rigid. This allows for the distribution of stresses over the abutment teeth, the underlying bone, and the soft tissues. It should not impinge on the pre-gingival margin. That is, the marginal gingiva is susceptible to injury from pressure. So we should avoid impingement on the pre-gingival margin. If it is in the maxillary arch, the border must be 6 mm away from the margin. And in the mandibular arch, it should be 3 mm away from the pre-gingival margin. The border should always run parallel to the gingival margin of the teeth. If in case it is crossing the gingival margin, it should be at right angles to the margin. And whenever it is crossing the margin, a relief must be provided between the metal and the soft tissue. There should not be any food entrapment areas. The major connector should maintain comfort. That is, the edges should be rounded and tapered towards the tissue. And the anterior border of the major connector should end on the valleys of the rugae rather than on the crest of the rugae. And it should not interfere with speech. The maxillary major connectors has already been discussed. Still, we'll have a look at the names of the maxillary major connectors. They are the single posterior bar, the palatal strap, the anterior posterior palatal bar, the horseshoe-shaped connector, the anterior posterior palatal strap, and the complete palate. This lecture is on mandibular major connectors. So we have 4 types of mandibular major connectors. One is the lingual bar. Next one is a lingual plate. The third one is a double lingual bar. And the fourth one is a labial bar. So first let's learn about lingual bar. This is the most frequently used mandibular major connector. So if you take a cross section of this mandibular major connector, it will be in the shape of a half pear with the broadest part at its inferior border near the floor of the mouth. That is, if you take a cross section of this major connector, we can see it is in the shape of a half pear with the broadest part near the floor of the mouth and tapering upwards. So what is the requirement of this bar? That is, what is the condition in which we can give a lingual bar? First and foremost, we need to have about 8 mm of space between the pre-gingival margin and the floor of the mouth. Then only there will be a 3 mm clearance from the gingival margin, and the major connector can have about 5 mm of height, which is required for the rigidity. So as you can see, we need to have about 8 mm from the pre-gingival margin to the floor of the mouth, so that we can have about 3 mm clearance from the gingival margin and have about 5 mm for the lingual bar mandibular major connector. The advantages of a lingual bar are it's a very simple design with very minimal contact with the remaining teeth and soft tissues. So there is decreased plaque accumulation and increased soft tissue simulation. There are certain disadvantages associated with a lingual bar. That is, If we are not giving care during the construction, the framework may not be rigid. And we cannot use this in cases where there is a mandibular tori. The next category is the lingual plate. This is also half pear shaped in cross section, but from this there is an extension onto the superior border of our anterior teeth. That is, the superior borders rest on the lingual surface of our anterior teeth. So it is like a labia bar with an extension onto the surface of your anterior teeth, lingual surface of the anterior teeth and resting on it. So the inferior border is located in the floor of the mouth and the superior border on the lingual surface of your anterior teeth. And the inferior border should be located in the floor of the mouth without interfering with the movements of the tongue. The superior border should be scalloped and the lingual plate should be supported on each end by rest. That is, we need to have rest on either side on the mesial fossa of the first premolar preferably. So what are the indications of a lingual plate? One is when there is insufficient space for a lingual bar. So as we have already learned, the lingual bar, we need about 8 millimeter space between the pregingival margin and the floor of the mouth. If that much space is not available, we cannot give a lingual bar. In such situations, we can give a lingual plate. Then, when one or more anterior teeth are periodontally compromised and warrants their replacement in the immediate future. And then next indication is when there is a need for indirect retention. And for patients with conditions that prevent the removal of a mandibular tori. The disadvantages of a lingual plate are there is extensive coverage which can contribute to the decalcification of the enamel in patients with poor oral hygiene. So we have to emphasize on the maintenance of oral hygiene in patients whom we advise lingual plate. The next mandibular major connector is the double lingual bar, which is also known as Kennedy bar. So in this, the position and contour of the upper and lower borders of a double lingual bar are similar to your lingual plate, but in between it is cut out. That is, there is a gap. So the lower bar is similar to the lingual bar and the upper bar presents as a scalloped appearance. This should also be supported on either side by occlusal rest on the mesial fossa of the premolars. The advantages are it is effectively extends the indirect retention in the anterior direction. But there are some disadvantages. That is, in cases of lower anterior crowding, the intimate contact with the tooth surface cannot be maintained. This can actually result in food entrapment. And there is a presence of multiple borders in this. So this is actually annoying to the tongue. The next mandibular major connector is the labial bar. The labial bar runs across the mucosa on the facial surface of the mandibular arch. All the other major connectors, they are lingually, but this major connector is labial. It is indicated only in cases where gross interference prevents the use of a lingual major connector, such as in the case of a malpositioned or lingually inclined teeth, or in cases where there is a large inoperable mandibular tori. As you can see in this diagram, the major connector is running in the labial direction. Here, it's not lingual. Next is a modification of the labial bar, which is called as a swing lock RPT. So it is a modification of the labial bar major connector, where the modified labial bar will have a hinge at one end and a locking device at the other. So there is an opening and closing action. So we can use it in opening position and then close it into its proper position. So this permits it to reach otherwise inaccessible undercuts on the labial surface of teeth. So as you can see in this diagram, there is a hinge and a locking mechanism. So when we are inserting it into the patient's mouth, it should be in an open position. And once it is seated, we can close it. So this is a diagram which shows the open and closed position of our swing lock RP. So the next category is the sublingual bar. This type of major connector is actually a modification of the lingual bar. So when there is insufficient height of our lingual sulcus, that is if it is less than 8 millimeter, we can give the lingual bar farther into the floor of the mouth. So the placement is more inferior and posterior than our conventional lingual bar. So it is lying over and parallel to the anterior floor of the mouth. But the disadvantage of this is there is interference with the frenum. Our lingual frenum there will be slight interference in using this type of mandibular major connector. So in this diagram, we can see the conventional position of our lingual bar is here. If it is a lingual plate, there will be a bar here and extending onto the lingual surface of our anterior teeth. But if it is a sublingual bar, it will be farther into the floor of the mouth, not as in a conventional lingual bar. It will be deep inside. In a continuous cingulum bar, the upper bar will be on the surface of our anterior teeth. So depending on the position and the amount of space available, we can decide on the type of mandibular major connector which can be given. So to summarize about major connectors, we have two types, that is the maxillary major connectors and the mandibular major connectors. In the maxillary major connectors, we have single posterior palatal bar, the palatal strap, the anterior posterior palatal bar, the horseshoe-shaped connector, the anterior posterior palatal strap, and the complete palate. In the mandibular major connectors, we have the lingual bar, the lingual plate, the double lingual bar, and the labial bar. And the modification of the labial bar being the swing lock RPD, and the modification of the lingual bar being the sublingual bar. With that, we come to the end of mandibular major connectors. Thank you.